that follow. So it's my pleasure to introduce Dr. Solange Gerona, head of the National Liver Transplant Program and Hepatology Service at the Central Hospital in Uruguay. Solange? And you're on mute at the moment. Thank you.
Hello, how are you? Thank you for the invitation and thank you for the support, John and Lindsay. Incredible. We would like first to share the video. I don't know if we can share it. It's a video that we created for starting the HIT project in Uruguay.
Es tiempo de despertar, de hacer hoy lo que ayer parecía inimaginable, dar un paso adelante. Es tiempo de saber.
We will put a link to it in the chat so you can watch it with subtitles in English, but wanted to give you a little preview of what it looks like. If you go on YouTube with the link provided in the chat, you'll be able to turn the English subtitles on so you can understand. Please go ahead, Dr. Gerona.
So the video was planned to start the kicking off of the HIT project and also to increase the awareness in the population. So we are presenting the first national survey for the evaluation of hepatitis B and C to expand the test and treatment HIT in Uruguay. And we are just starting. We are a little team of me, Andres Balsamo, that is an epidemiologist. He already works in the Ministry of Health. And Victoria Mainardi and Daniel Olivari are two staff hepatologists of the liver transplant program in our country. And we are like the basic team also with Camila that is working abroad. So we started this initiative with the help of HIT project and linking with, and the situation in Uruguay was that previously to 1 year before, there was no program nor guidance of public hepatitis B and C treatment from the Ministry of Health. So they asked us, this is the programmatic area that should run the work on hepatitis B and C together with HIV and SIDA. And so the previous year to the starting the HIT project, they asked us to write the guidelines to the treatment of hepatitis B and C. We have here the next, please. In Uruguay, a situation. Next, please. We started with establishing the working group, the coalition, and we included in the Ministry of Health the area that take care of this area. And then we have a government organism that is the one that finances the treatment for hepatitis C, not hepatitis B. So we gathered them in the work also as the public university of medicine. And also we invited providers from private and public provider and laboratories in also the society, the civil society of patients. Here we wanted to realise or share with you that our challenge is with the civil society of patients, because they have another plan or a plan that we still don't know which were both that plan. We started to a lot of conversation with them, and still we don't feel that they are in fact, they are in the opposite way. They are in the social media speaking that this is the end of the possibility for Uruguay. The thing is that Uruguay have been solving the problem, not in an organized way, but really had the financiation for a universal coverage of the treatment for all the Uruguayan people. So our challenge is not in the area of financiation of the treatment, but is to discover and treat or diagnose, as John was saying, the testing is our challenge, to find the people and to test them to see if they are or not infected, and then guide them, link them to the treatment. The next. So we are now in the phase 2 of the project that is starting to send compiling the existing data from different areas, no, epidemiologic and laboratory areas. And the good thing is that this hit was approved by the Ministry of Health, and we are sending the question through the Ministry of Health, because if not, we probably wouldn't have won't have the response or the interest to respond from the different institutions. So sending the question and doing this work through the Ministry of Health for us guarantee that it will have serial data, no, serious data. I don't know if I am being clear or you need something.
Yeah. Yes, you are.
Okay. The next. So what we achieved already now, no, although we are just starting with sending the questionnaires, we think that with this video and all the media, when we did the kickoff of the HIT project, we did in the Ministry of Health, all the television media, radio media, all were aware of that, and were one day that all were speaking about the hepatitis C, and people were saying, oh, I didn't know that this was an issue. So I think that we are learning or doing increasing the awareness of the impact of the hepatitis in the national level, and that make that the healthcare providers take the information. And for example, we already make them change some public policies, as for example, every worker in Uruguay have to every 2 years have to do a control of health, like see if they have diabetes, if they have like coronary disease, simple things, no? TBC, syphilis, or HIV. So we could include in this thing that is every 2 years for healthy people, working people, include the testing of HIV, ABC. Also, we had the issue that the people when was had a serological test positive for hepatitis C, this is not still for hepatitis B, but yes, for hepatitis C, they had to pay by themselves the PCR tests. And now they accepted to be included and paid by the institution, not from the people. And so that has secured that they continues on with the process of getting the treatment. And also, when we write the guidance for all the country of how to treat hepatitis C and B, we identified that the government didn't cover the non-responders patients, and so we make changes, and thus assessed the changes, and they take it. So now we have the coverage of the treatment for non-responders in hepatitis C. Next. So where are we? We still are very in a baby state. We are starting, and we are learning from all that have done a lot before, from all of you, and we feel that this will be like the starting point for a program. We still don't have a program. The Ministry of Health is not like with the willing to do it. Know that they also are thinking about this is expensive or this is so and so. We think that the main innovation we should do is a POC test in every primary attentional test, a point of care that we have tests, rapid tests instead of serological tests. I think that would be like growing the awareness and identification of hepatitis C infected patients. About hepatitis B, we didn't put it here. We are doing also the questionnaire. We are in a different position. Every baby has tested, every pregnant woman is tested, every baby is vaccinated as soon as he starts his life. So that is well done. It's not an issue for us. The issue for us is that we have only vaccination for babies and for health workers, HR workers, but not have for universal vaccination. And that is for what we are going to. So that is what I wanted to share. We have a lot of questions. We are starting and we need help, but we are open to help. Thank you.
No, thank you, Solange. You're off to a great start, and I think for you, you're really a prime example of the value of champions for hepatitis elimination. How someone takes it on as a mission, and you certainly have done that for Uruguay. And I think it's great to learn how the HEAT project has really stimulated, bringing the different stakeholders, to the table, the Ministry of Health, clinicians as you're representing, but also the civil society organizations, and the differences that you point out. I think you have a greater chance of resolving those if everybody's at the table, and hopefully, as you begin to collect data, everybody begins to agree on where the problem is the greatest and what should be done about it. So, do you remain optimistic that this can happen for Uruguay?
Yes, I think so. We have there's a change in the Ministry of Health also, that now the one that will become the Ministry of Health is the anesthesiologist of the liver transplant program. So, and she already did also a formation in England about public health, and her thesis issue was hepatitis C. So I think that this is an opening, and also that the social society of patients that are against now is because they still don't understand. They are in a misunderstanding of what we are wanting to do, and they think that we're bringing for money for us or something like that. And we have to understand that they are in suffering, and I have been also working on to implement and to help the country to get a solution. So I am optimistic, obviously.
Yeah, good. Yeah. As am I. I mean, I think these differences, we've had experience in resolving them elsewhere, and I think they can definitely be resolved in a way that everybody's pulling together in Uruguay. Dr. Angela showed how the modeling, how HEAT can lead to modeling to actually model a hepatitis elimination program for a country. Do you think that kind of modeling would be of value in Uruguay?
Yes, I think that will be, we were seeing that presentation, and we were speaking with Daniela here. And yes, I think that will clarify the issues and the questions and the resistance, and will help a lot when we be able to have the Harvard method and have the planification of how many people. It's like knowing how many people we have to test, how many people we have to do. It will organize the thing and will make the work easier. We have an expanded capacity for PCR testing in the country because of COVID. We are a little country of 3 million people, while we know very accessible. We don't have issues of accessibility. So having the PCR testing all around the country, I think that won't be an issue. So knowing how will be the pace and how calculate the pace with the money, with the resources we have, I think that will help a lot of setting the mindset we need to do the issues we have to solve.
Excellent.